Hey y'all, welcome back for another episode of Woman in White Coats by MD Tribe. This week we have Dr. Rachelle Daris, one of my good friends from FSU College of Medicine. I actually met her as a pre-med when I was interviewing for a scholarship, and she was a med student at the time. And then we connected again because we went to Panama together, and she was the trip leader for the trip. And then we just kept in touch ever since then. And I just love seeing her grow as a physician. And now she's a resident at LSU for pediatrics. And that's really exciting. So I'm so excited for her. And I just really excited for her to share her story with y'all and to share her wisdom and her journey and just everything in between on what it's like to be a resident, what her schedule is like, and what her life is like lately. So without further ado, here's episode 4 of Women in White Coats by MD Tribe. We're back with another episode of Women in White Coats with one of my favorite people.
Hey.
So, without further ado, can you go ahead and introduce yourself?
Right. Hey, guys. My name is Rachelle Daris. I am a pediatric resident at LSU.
And can you tell me a little bit about your ethnicity and where you grew up?
Okay, yes. So I am Haitian, 100% Haitian. I grew up in South Florida, Naples to be exact, but I pretty much claim all of South Florida, Miami, Naples, all of it.
And where did you go for medical school?
Oh, I am Noel-blooded all the way through. So Florida State Seminoles. Come on now.
Go Noles.
Go Noles.
Okay, so before we go ahead and dive right in, tell me a little bit about what you do outside of clinic.
Okay, outside of clinic, I definitely like to indulge in my TV shows. So I am a big binge watcher. So anytime someone tells me a good Netflix show, I'm on it. If it says based off true life events, then I'm already like 90% sold. I'm really big into yoga, but right now with all of COVID and everything, I haven't been getting as much into my yogi as I used to be. I'm more of a hot yoga, so that's kind of what has been limiting me. I'm not really so much in the house. And kind of just hanging out with friends, just, catching up with my loved ones, people I care about, and just, speaking to people. I'm not about medicine.
And so since you're a binge watcher, what's the last show you watched?
Okay, so I'm currently on the whole 90 Day Fiance saga. Like every single one of them, before the 90 days, after the 90 days, what now? Just if you want to talk 90 Day Fiance, I'm the person.
Okay, and you just moved to Louisiana, right?
Yes, just moved to New Orleans during COVID. So that was interesting because during that time it was considered a hot spot. But I think that I feel very safe here, honestly. Everyone wears masks. Like, you're not allowed to go anywhere without a mask. So I honestly feel safer here than Florida.
Okay. I think everybody feels safer in other places that's not Florida. So my next question is, what brought you to pursue your career as a physician?
Okay. I always tell people I didn't really have a plan B because I didn't. I think I knew since I was like 7, like literally second grade-ish. I just one day said, I'm going to be a pediatrician, not even a doctor. I said, I'm going to be a pediatrician. And I think I just have a lot of family members in medicine. My mom was in nursing school at that time. I have a lot of doctors in my family. My godfather is a pediatrician. So I think just medicine is just a lot in my family. And so it was easy for me to become just enthralled with everything.
Okay. And what was your journey to medical school like?
Okay. So I was one of those who took the MCAT 3 times.
Okay.
I think I kind of got to the end of undergrad and I looked around and everyone's kind of applying to medical school. And I was sitting there like, oh, wait, I haven't even taken my MCAT yet. So I took my MCAT 3 times and I think I got, well, this was like before it changed. So I don't even remember what I got, but I remember the second time I took it, my score actually went down. And I remember I freaked out because I was just like, oh my gosh, like that's gonna look horrible. Like that basically means like, I'm not doing as well. But what I think really happened was after I took the first one, I looked at like the sections that I did poorly on and I only really like reviewed those sections. And so when I took it the second time, those 2 sections went up, but then the section I didn't review went down. And so it went down more than the other 2 went up. So it was just a mess. So I knew I had to do like a post-bac type of grad program. So I went into the USF MSP3. My goal when I went there wasn't even to graduate, honestly, because I knew that I wanted to come back to FSU and I kind of knew that FSU's semester started the same, like the last semester of USF. You know what I mean? So my whole goal when I went to USF was to get straight A's the fall semester. Like that's all I cared about because I knew I would get an interview sometime in the spring. So as long as I could show them that, hey, look, I went to a grad school and don't worry about those 3 MCATs. Like look at these straight A's that I'm getting in grad school. Mm-hmm. And that's exactly what I did. I just like busted my tail, got straight A's that fall semester, had my interview at FSU like that February, I think.
Yeah.
And it was, history.
Did you finish the spring semester or did you?
I did finish the spring semester, but I didn't graduate. So I didn't do like whatever is in the summer. I was kind of debating whether or not, because I know you went back. I'm so proud of you. I honestly debated whether or not I wanted to do that because I felt like you put in so much work for those 2 semesters and to kind of like not have anything tangible to show for it. Like people don't know I went to USF for 9 months. Like,
yeah, I debated it for a while too, but then I just, COVID happened and I was like, why not?
It was a perfect time. Yeah.
Okay. So next question, were there like as a woman and as a minority in general, since we do make up the least amount of doctors in medicine, did you face any particular challenges or doubts?
I would definitely say yes. I would say more so as a minority than a female. I would say more like people I've noticed who have challenges as a female, they're going more into like surgical type of specialty. So in pediatrics, for me, my specialty, I haven't really had that much adversity as a female. But as a minority, more so from patients, I think. I have like a lot of patients who kind of question how I got here or telling me how they're in this school because, they're not an African American, so affirmative action wasn't on their side. And the only reason I'm in med school is because of affirmative action. So, having to listen to all of that and go, okay, so back to your blood pressure, so you really have to be able to compartmentalize and just give objective medicine. Like, I've had people tell me that I have slave mentality and I have to just sit there and listen to all of it and still give them very good medical care. So it's challenging, but I think like I'm also from Naples, Florida, where I can count on my hand how many Black friends I had in my school. So I think I'm also just kind of used to that. And I just know how to like brush it off my shoulders more. But I think it's getting better. I will say that.
Because I know representation is really important in medicine, especially when you're training. How did you feel in terms of support in medical school and now as in residency?
In medical school, I think I found my people. I think that it's important in anywhere you go that you find your people that you feel supported by and that you can go to whenever, you need to vent or things are happening. I would say medical school was okay. I think I found more of like friends that I could rely on more so than actual faculty and staff, which is okay. But I would say in my residency program, I feel much more supported. I feel like I can talk to my program director about like anything that I'm feeling. And I feel like she doesn't just like talk the talk, she walks the walk. So I feel like it's one thing to, see things happening and see discrimination and see disparities and just see it happening and note it. But then it's something else to then take it a step further and go, okay, what can we do to stop this? What can we do to change this? And I'm noticing I've only been in my residency program like 3 months, and there's so many things that have been brought up that are already in the acts and in the works to change. So I think that shows me that they take what I say serious. So I appreciate that.
Oh, that's nice. Well, I'm glad you're having a good experience so far. And that kind of perfectly leads me into my next question about your residency. So what was your experience like going into match?
Okay, going into match, I would say I was a little on the nervous side because I was definitely someone whose step 1 was not great. Let's see, passing was 194, I think, at my time, and my step 1 was 200. So like just passed, barely hit the 200s. So I was just like nervous for that sake. I was just nervous because like you already kind of shut yourself out of some residency programs just because, they have a filtering system. Like they have a minimum step 1, so they don't really care how great you are. If you're not hitting this 215, like the way the system is, it automatically just kicks your application back out. So because of that, I felt nervous kind of going in, just like, okay, I'm going to like limit myself on where I can really apply just based off of that one number. But I also went into my step 2 knowing that you need at least like close to a 30-point increase, which I thankfully got. But it doesn't matter. That step, yeah, just a little increase, but that step 1 really does like matter. So that made me nervous. But again, I'm going into pediatrics, which, tends to be a little bit nicer with step scores. What also helped me was I did an away at the place that I really wanted to go to. So that made me feel a little better about applying because I knew these people knew me, but it was still nerve-wracking. Yeah.
Can you explain what an away rotation is?
Yes. So an away rotation is basically like what I call a mini interview. So it is where you sign up at a different institution and you pick exactly what rotation you want to do there. So I did aways at LSU. So I came here and did an away. So I did 2 weeks of inpatient pediatric medicine. And then I did 2 weeks of adolescent medicine, which is basically like clinic life, but for teenagers. So doing like outpatient clinic, but for the teenagers because they have like a whole different type of history you have to obtain. And it's kind of just like a different type of vibe, to get teenagers to trust you compared to a little 2-year-old or a 3-year-old. I also did an away at Harvard at Boston Children. I did a month at doing pediatric emergency medicine, which I loved because I think that's what I want to do. So it kind of just like helped reaffirm that, okay, yeah, I think you want to go down this path. But yeah, so it's basically a month-long rotation where you go to another institution and you act like one of their interns. And an intern is just like a first-year resident. So they kind of take you out of the role of a medical student and they kind of, put you up a little bit. So you get like a little bit more responsibilities, but it's also for you to see the flow. So they're interviewing you at that time as much as you are seeing, do I like this place? So to me, I like the way rotations because after a month, they can't really hide. They can't really like fake the funk for a month. So you get to really see like, do I vibe with these residents? Like, do I like the flow of this hospital? Do I like this city? Do I want to live in Boston? Do I want to live in New Orleans? Because you also want to live somewhere that outside of the hospital, you have things to do. And that was important to me as well.
How many places did you apply to and how many did you interview at?
My step 1 score definitely helped determine how many I applied to. Maybe 38 places I applied.
Okay.
There's some people who are like, you should hit at least 60 places. To me, I didn't think so. there weren't even 60 places I wanted to live. So, and that was something else. Like, I wanted to make sure the places I applied, I wanted to go to. So I did not want to apply somewhere just to hit 60 if they would give me an interview and I wouldn't take it. You know what I mean?
Mm-hmm.
So I wanted to be realistic that the places that I applied to, if that was the only place I got an offer, I would go there and be happy. Okay. And so that's kind of how I approached it. So there was only 38 places that I felt like I would be happy by myself. You know what I mean? Because I would have to move somewhere that I don't know anybody, don't have any family.
Yeah.
So I applied to 38 places, I think like within 7 or 8 states. I didn't really do too much on the West Coast because, again, I didn't really care to be over there, and it's money. You gotta fly over there for the interview. You have to get the hotel. You have to pay. So, nah. I think I ended up doing 12 interviews.
Okay.
And that's just because, like, statistically, they're kind of like, if you do at least 12 interviews, your likelihood of matching is just like very good.
Okay.
I did as many interviews as I got offered.
Okay.
Yeah.
And now that you're graduated and working as a resident, how's your experience been?
Working? I love it, honestly. The hours are definitely long, but what I realize is, like, I don't really realize how long the hours are until I'm leaving the hospital. I'll be like, oh my God, I just worked 11 hours, or oh my God, I was here 15 hours. But to me, that kind of just shows that, like, I'm enjoying what I'm doing.
Yeah.
So I may leave like, oh my gosh, I'm so tired. But in the moment, I don't realize that I've been running around for the last 15 hours just because I'm just so into it. Like,
what has your schedule been like?
First started off, so I can tell you, like, so we're on month 3. So I've actually done like 4 rotations so far. So the first rotation was CARE, which is our child abuse rotation. So it's basically a 2-week rotation that's dedicated strictly to just learning how to investigate child abuse, sexual abuse, neglect, like anything like that, how to do the physical exam for those type of encounters, how to do the history for those type of encounters, because it's different than how, you and I were taught in medical school, because these histories and these exams have to be used in court. So you have to interview in a way that you're not leading on. So, we'd go, so tell me what happened last night when you fell off the swing, Johnny. Automatically that couldn't be used because they would say you're leading him. So you'd have to just sit there and be like, tell me what happened. Tell me more. Tell me more. So it was interesting for me just to see a different type of interviewing.
Okay.
And then I went and did inpatient medicine. So inpatient medicine is basically what you and I would think of as working in the hospital on the floors. So it's a 6:30 to 6:30 shift here at my hospital. We don't really do 24-hour calls. Everything is shift work, 12 hours. So you either come in the morning at 6:30, and then you get sign out from the night team. They kind of tell you what happened over the night, any new patients that came in. And then from like 6:30 to 9, that's kind of when we would go see our patients, round on our patients, write our notes. We have medical students who work with us. So we'll also like help them with their presentations and their notes. And then from 9 to 12 or 9:30 to 12, that's when we round as a group. And it's like 10 to 15 of us. It's a pretty big group because it's all the residents, all the medical students. Sometimes we have social work. Sometimes like other consulting groups will come. And then we'll round till 12, go have lunch, go to noon conference, which is kind of like lecture time for residents where we'll talk about interesting cases or just what's going on for the month. So something else that I really love, my program started a diversity curriculum. Okay. So every month it's a mandatory noon conference where we kind of just like talk about what's been going on in the nation. We discuss like the latest articles that came out, like the article that came out about, Black babies are more likely to die if they're being taken care of by a white doctor compared to a Black doctor. So we talk about those articles. Mm-hmm. We talk about like the climate in the nation. So that was something that was just recently started that I truly enjoy, because not only is it mandatory, they break us off into like little discussion groups and we all have to like contribute and talk. And they also started a Wake Up Wednesday, which I also enjoy. So every Wednesday they send out emails about like, hey guys, you need to wake up and realize what's going on in the country. So
okay.
I like that. And afternoon conference, we do table rounding, which is kind of checking up on what you did after we rounded and making sure those things got done. Like if the patient was supposed to go to imaging, did they go? If the patient was supposed to see this consult team, did they see them? And just kind of, continually checking back in and making sure everything is getting done and nothing's falling through the cracks. And then we do like a teaching moment. So after that, we'll do educational sessions for our medical students. We'll do lectures. We'll talk about any interesting cases we had. And then you either go home if you're the short person. So you'll go home around 3, and then one person will stay for the 6 until 6:30. So we just take turns doing that throughout the week.
Cool.
Yeah, so that's inpatient. And then right now I'm on ED, which I love, back in the ED. So we only do 10-hour shifts. Again, that's something that to me is nothing because in our medical school, we do 12-hour shifts. So to go from that to 10 to like 9-10 hours, it's a piece of cake. So I think medical school helped prepare me more so for these ED shifts because I'm used to working longer hours.
Okay.
So that way, when we get to the 10 hours here, I still have energy. I'm still like, oh, okay. Yeah, I'll go home. You want me to stay? Okay. So, but enjoying everything so far. So everything that I've done so far has been medicine that I've kind of done. So I've done inpatient before and I've done PDM before. So it's nice to see that I still like it. And after this, I'll move more into like development. So learning more of like how the baby grows up and are they meeting all their milestones. So that'll be a different type of rotation. So I'm intrigued to see what that entails.
That's so cool. Wow, I didn't realize there was like so much. So what would you say when you were applying to residency? I know obviously your grades and passing your rotations and stuff like that mattered. Is there anything extracurricular or like research wise that you did that you felt helped you stand out?
Yes. As part of our 3rd-year curriculum, we have to do a QI project, which is basically a quality improvement. We had to work with a hospital and kind of just like jumped on to what they were already doing. So usually hospitals will like take a look at things that can be improved in their hospital. And they kind of do like a little mini research in their hospital, say, okay, this is something that's a problem. This is how we can improve it. We're going to do this research for the next 3 months, and we expect to improve it by this many percentage. So for instance, a lot of it was like hand washing. Okay, there's a lot of like, infections on the 4th floor. So we need to improve the hand washing of our nurses for the next 3 months, start like recording the nurses who wash their hands in and out of rooms. And we're going to see the decrease of infection rate by 20%. Like, so that's like the type of statement you would want to say for a QI.
Okay.
And for my QI, it was more so about the suicidal prevention in the hospital. So a lot of the hospitals have like a behavioral health center. And then when those patients kind of need like medical needs, they'll send them to like the main hospital. Okay. But what's getting kind of lost is a lot of the precautions those patients had in the behavioral health unit, they're not getting in the hospital. So the suicide rate was going up because now they have access to things that they should not have access to. And, they're trying to hang themselves or what may have you. So our QI project basically was to go around the hospital, go to every single department and take a look around the rooms and say, what can somebody use as a ligature point, which is basically a tying point. Like I can tie something around this and hold it with my weight. And also what can somebody use as ligature? So for instance, like those EKG cords can be used as, somebody can tie it around their neck, or these sheets you can rip these sheets too easily. So we need to get sheets that don't rip as easily. The beds were too high. So, you could tie something around the foot of the bed. So making the bed lower to the ground. So there's no point to tie around. So that was kind of like our QI project. And people loved that. Like, I think every single one of my interviews mentioned my QI project.
Oh, that's so
and I think it's just the fact that it's a QI project more so than research. And it just kind of shows that you're trying to improve the health of patients in the hospital. That's all a QI project is, like trying to make improvements to improve the safety and health of a patient.
Oh, that's so cool. I didn't even know that was a thing.
Yeah, I didn't either until I got to third year medical school because I realized I'm not big on research. Like, I don't like sitting in a lab with like, pipettes and stuff. Like, that's not me. I like social research. So I did like a research on college men's sexual health where I just kind of went around FSU talking to all the guys, figuring out what would make them wear a condom, why don't they wear a condom, and kind of like, just their sexual health behaviors. To me, that was a more interesting research, like getting out into the community and talking to people. So I think also trying to find what type of research you like or what other curricular activities you like. Don't just do something just to do it.
Yeah.
So you want to enjoy it. So that way, when you get to your interview and they ask you questions, you can talk about it and you sound like somebody who is happy to be doing it. Just like kind of like helping mentor. There's a lot of organizations that are out that kind of just want somebody who is like above them in a sense, like has kind of like made it to where they're trying to get to, kind of just come back and explain your story. Just explain how you got to where you are. If there's any ways you can help open doors. I also taught biology to 8th graders. So just having some type of like teaching, because as doctors, we're teachers. We have to teach the patient about, how to live better, how to have a healthier lifestyle. As a pediatrician, we're constantly helping to teach parents and counsel parents. So just showing other things you do besides just study. So you want to show that you're a well-rounded person. Like, yes, I can study and get good grades, but I can study and get good grades while I taught, while I worked, while I did research, while I did, you want to show that you can balance a lot of things.
So you did 4 years of med school, and then you're going to do 3 years of residency.
Yes.
Do you plan on doing a fellowship?
Yes. So I definitely plan on doing a fellowship, especially in peds now. It's kind of changing a lot where unless you want to do strictly outpatient medicine, you're doing a fellowship. Okay. So this year is the first year where even if you want to be a hospitalist, like just to work in the hospital, you have to do a 3-year fellowship. So before this year, you kind of could do either one. You could kind of just like graduate pediatric residency and then stay in the hospital or, transition to more of an outpatient clinic. But now they're kind of doing it where it's called a hospitalist fellowship. So everything's 3 years. And I'm probably thinking about doing emergency medicine. So I'll do another 3 years to be certified as a pediatric emergency medicine physician. So yeah, I'm looking at 6 years.
Wow.
That's just because peds likes research. They just want research.
Yeah.
So all of our fellowships will be 3 years because they kind of want you just to contribute to the world of medicine by doing months of research and just contributing to that field.
Okay, interesting.
Yeah.
So cool. Okay.
I'll be there for a while.
My last question is, if you could offer 2 golden nuggets to a pre-med or somebody that's just pre-health in general, what would they be?
My first golden nugget would definitely be, do not compare yourself. Okay. I think that, I know we hear it all the time and it's hard to it's easier to say than do, but I think when you start comparing yourself and realizing like, oh, why am I not doing that? That's when you start to forget about your own to-do list and your own plans.
Yeah.
I think that write it all down. Just have out for yourself what you plan to do. And it doesn't matter what anybody else is doing. You have your goals. You have your steps to achieve that. If using this textbook works to study, who cares that nobody else is using this textbook? They're using that, and that. When you start adding in what everybody else is doing, that's kind of when you get lost in the sauce. Yeah. So stick to what works for you. Stick to your own goals and just kind of, don't let what other people are doing weigh you down. My other golden nugget would definitely be enjoy the moment.
Okay.
Because I think sometimes we kind of get caught up in achieving the next step and achieving the next step. We forget to sometimes appreciate where we are.
Yeah.
And kind of, be happy and be proud of yourself that, okay, I made it past chemistry. Yay. Like I made it past organic. Yay. Like celebrate those little wins as well as celebrating the trophy. So yes, getting to medical school is our ultimate goal, but we all know there are so many little things before we get to medical school that deserve to be celebrated. Like you signed up for the MCAT, good job. Like it takes some people a long time even to sign up for the MCAT. You studied today, good job. Like I know you were tired. I know you got out of class and you had to come home and the last thing you wanted to do was study another 3 hours of physics, but good job. Like, so I think do not compare yourself to other people and remember to stop and, smell the roses and appreciate where we are now. And appreciate where we are now. I think that's something that I kind of forgot and I'm trying to get back to now, even as a resident. Like I dream to be in this moment and I need to stop and just appreciate all of the trials and tribulations and hoops I jumped through and fires I crossed and nails I walked on just to get here. Yeah. And when I see my patients who are just like, oh my God, I'm so happy you're my doctor. I prayed for you. And I'm like, you prayed for me? And it just like, like moments like that make me go back and wonder, what was I complaining about?
Yeah.
So I think just staying in the moment and just remember to appreciate why we started and where we are now in this journey will help keep our sanity. Because medicine is lifelong learning. It's very easy to get jaded. It's very easy to kind of, get lost in the repetitiveness of wake up, work, sleep, study, wake up, work, sleep, study. And it's like, what about my family? What about my friends? So I think having your why in your mind to go back to when you're starting to have those thoughts is so helpful because we're needed, so women in white coats.
So good. I don't even want to say anything else because that was the perfect way to end it. But
thank you. Thank you.
I hope you have a great rest of your day. Thank you.
Yes, you as well. Thank you, young Black physician.
Oh, yeah.